Welcome to today's webinar, and this one is a continuation of the discussion we've had over the past 3 weeks. This is week 3. This is continuing the discussion, or a common theme in the discussion over the past couple weeks, where we've talked about genetic contributions to chronic inflammation and to thyroid dysfunction. And today we're going to talk about natural Hashimoto's thyroiditis treatment and the evidence for using laser and nutrition to improve thyroid function, reduce the autoimmune attack, and reduce medication dose. And the themes from the previous 2 weeks will wrap in and snap into this as we go, and I'll point that out. So whether or not you've heard those videos, if you haven't, go back, you can go back and watch those. But if you haven't, today's will be sufficient in and of itself for those looking who are peaked just from the Hashimoto's standpoint of things. So let's dive in. First, we want to understand what Hashimoto's thyroiditis is. Hashimoto's is the #1 cause of hypothyroidism in the United States, and hypothyroidism is a low-functioning thyroid. What is your thyroid gland? Your thyroid gland is a butterfly-shaped gland in your neck, and the thyroid sets the metabolic rate of every cell in your body. So for you to have a metabolism, your thyroid needs to be working optimally, or for you to have an optimal metabolism. When you're hypothyroid, that means the thyroid is functioning suboptimally or too low. So you would have a lower metabolism. And so, you know, the most when I say low metabolism, the layperson will think of first probably weight loss, right? So if you have a low metabolism, you may gain weight or have difficulty losing weight. But also other common symptoms with hypothyroidism include cold hands and feet, constipation, because low metabolism slows down the motility in the gut, okay? Brain fog, because a low metabolism of neurons drives brain fog and cognitive dysfunction and maybe depression or anxiety. You might have heart rate and rhythm changes, slowing down with hypothyroidism, speeding up in palpitations with hyperthyroidism. We talked about the weight gain. You could have hair, skin, and nail issues because hair, skin, and nails are constantly turning over and growing, right? So it's a high metabolic demand. So if your metabolism slows, you could have weaker nails, you know, hair loss and worse skin, drier skin, that sort of thing. So hypothyroidism is very, very common, and Hashimoto's thyroiditis, which is autoimmune thyroid disease, is the most common cause of hypothyroidism. Hashimoto's disease is the most common autoimmune disease in the United States, and it prefers or shows up more commonly in women than in men. What occurs in Hashimoto's disease? Well, it's an autoimmune disease, so your own immune system is attacking your thyroid. And specifically, it's attacking the thyroid follicles, which are, you could picture our 5-gallon drums holding thyroid hormone, okay? So if the immune system attacks your 5-gallon drum, say your thyroid is a butterfly-shaped warehouse full of 5-gallon drums of thyroid hormone, okay? Your immune system shows up to attack it as an autoimmune attack. So your immune system has their machine guns and it's going, you know, and just blasting holes in all your 5-gallon drums. So your drums start leaking out thyroid hormone. Well, this happens and manifests sometimes as what's called a thyroid storm. So you have this transient hyperthyroid symptoms as you have that acute immune attack on your 5-gallon drums, and you have that acute dumping or loss of fluids all over the floor, or dumping of thyroid hormone into the system. That could cause a short-term thyroid storm or hyperthyroid symptoms where you might be heat intolerant and you might have heart palpitations and anxiety and rapid weight loss. But then as the barrels drip out, right, and the fluid runs out, now you're low thyroid, you're hypo, and now all those other symptoms I just listed can occur. So when that happens after the attackers leave, instead of having nice, healthy 5-gallon drums full of hormone fluid, now you've got empty barrels with a bunch of holes in them, okay, which are useless. In real life, those follicles that used to be full of hormone are damaged and replaced with fibrotic tissue. And that fibrotic tissue is the barrels with the holes in it. It's useless in terms of providing thyroid hormone and thyroid function for you. So obviously, if you want to have an optimal metabolism, we want to optimize thyroid function. Ideally, we would never develop Hashimoto's and have autoimmunity. And there's hundreds of videos on my channel to help you with that. But this video, we're talking about you have Hashimoto's already. So our goal is to optimize your thyroid's function in the context of Hashimoto's disease. Can we promote optimal thyroid function? Can we minimize autoimmune attack? And can we minimize or eliminate your requirement for thyroid hormone? Now, you can see in yellow here, there's a quote that says, "No current treatment for underlying pathological mechanisms is available for Hashimoto's thyroiditis." So this is the mainstream stance, basically. And you know, what it says in lay terms is that there's nothing we can do to stop the underlying driver of Hashimoto's. So here's some Synthroid or levothyroxine, some T4 replacement, and see you later. Check back in a month, we'll refill your prescription. And so if that's the accepted, you know, dogma, then no one's going to try, and no conventional doctor is going to try and go any further than prescribing you that hormone, right? Because they're taught there's nothing we can do to stop it, so just palliate them with this drug. But that is, you know, not true, as it's untrue with just about everything we talk about, all chronic diseases. There's always something you can do. And today we're going to talk about specific things that can address the underlying pathologic mechanisms in Hashimoto's naturally, so that you can have optimal thyroid function, minimize autoimmune attack, and minimize need for thyroid medication. So let's go. So as I said, the research says otherwise. The research says there are options for us in terms of optimizing thyroid function that are not hormone replacement related. One of those things is photobiomodulation, also known as low-level light therapy, or cold laser therapy. Cold laser therapy in the research has shown efficacy in addressing the, quote, underlying pathologic mechanisms of Hashimoto's disease. So if we can use cold laser to improve thyroid function. We're going to get into that research in a little bit. The research also repeatedly has shown that nutrients are key for thyroid function in Hashimoto's, specifically vitamin D and selenium, but there are others. And in my best-selling book, The Autoimmune Answer, that you can find on Amazon, all of chapter 7 is about thyroid autoimmunity. And in there, I dive into further nutrients that you should take, nutrients you should avoid, foods in your diet you should eat and not eat. So there is lots of research supporting natural ways to address Hashimoto's disease. And this webinar, we're going to talk about cold laser, vitamin D, and a little bit about selenium. So how does the laser therapy work? Again, you see photobiomodulation, that's just a fancy term for laser therapy, but I think it's worth talking about. If we break down photobiomodulation, it sounds like a big nerdy term, but if you break it down into 3 parts, you can break it down into photo, bio, and modulation. The photo part stands for light, okay, so think of light. The bio is the body, and modulation is you can impact the body's physiologic processes. You can turn them up or down, you can modulate them. So photobiomodulation literally means light changes the body, okay? So as this picture shows, photobiomodulation is like jump starting a dead car battery. It improves the function of mitochondria within the cell, which increases ATP production. So even simpler than that, you can see the mitochondria in this picture. The mitochondria is the red thing on the right. That red thing on the right looks like a little kidney bean. If you look at the blue thing on the left, the blue thing on the left is one of your cells. Okay, we have trillions of these cells in our body. So the whole blue thing is a cell, And that blue thing, you can see the little kidney beans floating around in it. Those are the mitochondria. Mitochondria are the powerhouses of our cells. Mitochondria make energy, which is called ATP, adenosine triphosphate, and that ATP is the energy currency our body uses to do work, okay? So if we can shine a light on a cell or on a tissue or an organ or a body, the light goes into the mitochondria, hits them, and in the mitochondria, you have what's called the electron transport chain, which is how ATP is made. And specifically, the light hits the cytochrome C oxidase part of that chain and increases ATP production. So we can literally increase your energy by increasing or by shining laser on you, shining light on you. And if we can increase your energy, right, depending on the cell that we're increasing the energy in, we can increase the metabolic outcomes of that cell, right? So if you have more energy, you can do more work. So if that cell is a neuron, we can improve your brain function. If that cell is a wound, we can speed healing. If that cell is your thyroid, we can improve thyroid function. Whatever cell we're shining it on, we can improve the function of that cell, tissue, or organ by shining the light on it. So it's really cool, and it provides a broad range of things that laser can help with. Here's a graphic from a study showing the impact of lasers for the brain. So if you have Parkinson's disease, or you have traumatic brain injury, or you have anxiety, or you have neurodevelopmental disorder like autism or learning disabilities, or whatever it is, we can use laser on the brain to improve brain function, from blood flow to synaptogenesis, which is the way that neurons talk to each other. The more synapses you have, the more pathways you have, the more you can remember, the more you can do. Laser increases nerve growth factors in the brain, so those nerves can be healthier and connect better. It improves nerve brain stem cells, and it decreases brain inflammation, brain swelling, and brain excitotoxicity, which is, you know, if you think of MSG, MSG is a neurotoxin. It's excitotoxic. It makes your neurons work too much and eventually explode, is a way to think about it. So the laser use on the brain is anti-inflammatory and promotes healing and brain connection, which leads to brain function. If we think about laser for healing and recovery, this graphic's from NeuroSolutions and Dr. Ryan Cedermark. And again, red light therapy, laser therapy improves circulation, which improves nutrient delivery to whatever site you're trying to drive it to. It improves oxygenation, so all tissues need oxygen. It decreases pain and inflammation, increases energy, muscle strength, decreased soreness after exercise, restoration of range of motion. There's studies showing that post-surgical, it speeds surgical recovery, even with bone grafts. So there's a lot of benefit for physical therapy, manual therapy, performance. Lasers for the gut. This is new research, but using laser in the gut, specifically the infrared spectrum, again, this is from Dr. Cedermark, but lasers in the infrared spectrum, which you can't see, okay, but is still produced by the laser, shows that, you know, one study showed a 10,000-fold increase in the ratio of healthy probiotics in the gut compared to not using laser. So we can improve the microbiome with near infrared light. With the red light, you can improve the gut healing and the gut ATP production and the blood flow and the oxygenation. So GI issues, laser can be used for those, and it is being used for those in the research, in my office, anywhere people know this information. Laser for anxiety is very, very effective. There's many studies on laser for anxiety and depression. Here's a sampling of a couple. And what you can see on your far left is that laser with near infrared for general anxiety disorder is very effective. You can see they used it daily for 20 minutes a day for 8 weeks. And there was a significant reduction in the total anxiety scores on certain anxiety surveys that they use in anxiety treatment, as well as a significant improvement in sleep with no serious adverse events. So that study ends with, near infrared for anxiety is a promising alternative treatment. And I should say, I didn't say earlier, but there's almost no negative side effects from laser. Basically, as long as you're not shining it directly into your eyeball, you're good to go. So it's non-invasive, it's safe, it's inexpensive, it's great. The middle study concludes that transcranial laser improves brain activity and may clinically decrease anxiety and depression. And then the study on the right says laser prevents anxiety and depression via increasing serotonin and nitric oxide levels. So this study is pretty interesting. If you look at the blue down at the bottom, it says near infrared laser improved behavioral results, decreased cortisol levels, increased serotonin, and decreased nitric oxide in the prefrontal cortex and the hippocampus. The hippocampus is where short-term memory is. The hippocampus sets your circadian rhythm and impacts stress response. The prefrontal cortex is our executive function. So that's where dopamine and serotonin are happening, so we can focus, concentrate, plan, set goals, etc. So in this study, they used near infrared and showed maximum effects in behavioral and molecular results. Our results demonstrated that it had an anti-anxiety and anti-depression effect, which is probably linked to increasing serotonin and decreasing nitric oxide in the prefrontal cortex and the hippocampus. So again, if you have anxiety, or you know someone with anxiety or depression, laser has been shown to be very efficacious for that. And then you can use laser for almost anything else. This graphic is pulled from a study that was published in 2020, and in it they're talking about using laser for recovery from current events from the past 2 years, if you know what I'm talking about. But they also talk about how you can use laser for basically anything else in the body. And here's a graphic showing you many of those sites, from TMJ pain to neck pain to Alzheimer's to arthritis to peripheral neuropathy to the gut microbiome to sexual dysfunction. And then you can use laser on your family because ultimately you want to help them, right? So here's a couple graphics of my family. I'm using it on my little dude there on the left. We were at my sister's for Christmas, and he thought it was cool to see how many stairs he could jump down. And I think 3 is what he got to before he got hurt. So he was having some foot pain and not able to walk. So I was lasering him and getting him walking almost immediately afterward once we got home and I had access to my lasers again. In the middle there is my dad, and we're doing laser on his lungs post-infection. And you know what I'm talking about there. So, double pneumonia, we're using lasers on that. So let's look at laser for Hashimoto's specifically. So this study is titled The Impact of Photobiomodulation, or the Impact of Laser on T3-T4 Ratio and Quality of Life in Hashimoto's Thyroiditis. And so in this study, what they did is they wanted to see, can laser benefit Hashimoto's patients? So they looked at a total of 350 patients that were already diagnosed with Hashimoto's disease. Group 1 was 210 of those patients. Group 1 received laser therapy and supplements such as vitamin D, iron, and selenium. Group 2 was 140 people with Hashimoto's. They didn't receive laser. They received the supplements only. And what they wanted to measure was they wanted to keep track of, well, what were the patient's needs for T4 replacement or Synthroid or levothyroxine, okay, which is the most common medication given. They also want to observe their impacts on T3 and T4 levels, TSH levels, T3-T4 ratio, and thyroid antibody levels. The thyroid antibodies are what are the evidence of the autoimmune attack. And so the results of the study show that in comparing both groups, the increase in T3 levels, which is the most metabolically active form of thyroid hormone, and the T3 to T4 ratio was markedly superior in group 1, in the laser group. The decrease in thyroid peroxidase antibody levels was also significantly different between both groups, greater in the laser group. So the laser reduced antibody levels more, suggesting reduced autoimmune attack. And the hormone replacement needs were also significantly decreased in the laser group compared to the supplement-only group. In blue, low-level laser therapy is 70 times more effective in increasing T3 to T4 ratio and 15 times more effective in decreasing medication dosage than the supplements alone. So in conclusion, laser seems to be very effective in increasing T3 to T4 ratio and decreasing antibody levels and weekly doses of thyroid hormone replacement therapy. Anti-inflammatory properties of laser are greatly responsible for these changes, and laser causes major improvements in Hashimoto's related symptoms of the patient. Boom. That would be enough in and of itself, but I want to get a little more granular here. Here's in red here, here's the line from the study saying no current treatment for underlying pathologic mechanisms in Hashimoto's is available. So that's why they want to study laser and supplements to say, hey, we think there is, let's prove it. Laser is non-invasive, low risk, easy to perform, and low cost right there. So we showed you, they took the 340 people. It's interesting, you know, they did the laser, we talked about that, and we'll talk about that more, but the supplements were vitamin D, iron, and selenium. And vitamin D deficiency was considered, you know, in this study, if they had less than 40 vitamin D, they would replace it. People with iron levels less than 30, they received iron, and then everyone was given 100 micrograms of selenium. So you saw the results. People with just the supplements improved, but people with laser and supplements improved 70 times better T3, T4 ratio and 15 times less medication dose. So that's really important. How did the laser work? Why does the laser get those results? Laser interacts with the photoacceptors of the mitochondria, basically, okay? So because of this, ATP production, nitric oxide, and calcium levels increase, stimulating expression of cytokines and growth factors. Overall cell protection and cell regeneration occurs, okay? It increases circulation, it improves thyroid hormone function. It increases the T3, T4 ratio. If this ratio is low, it indicates there's insufficient conversion of T4 hormone to T3. The distortion of this transformation determines the intensity of symptoms. So if we can improve the T3 to T4 ratio, we're reducing Hashimoto's symptoms, improving T3 levels for the body. Both T3 levels and T3 to T4 ratio increase in group 1. We established a significant reduction in the patient's needs for hormone replacement therapy, which suggests improved thyroid function and regeneration. All patients demonstrate a decrease in thyroid hormone dose, and 60 of the patients, or 28% of them, stopped using the medication completely at the end of 3 months. So this, I didn't say that earlier, but what they did was they gave them 6 sessions, were applied twice daily for a total of 3 days. So 6 laser sessions, twice a day for 3 days is what it took. There were no side effects, you can see here, and no protection was required. It's very safe. Okay, so 28% of people no longer needed medication. 28% of Hashimoto's patients no longer needed medication at the end of care. In a different study, these authors note 47% of the patients in that study were able to stop their medication. So multiple studies are showing that a high amount of patients, Hashimoto's patients that receive laser, no longer need medication. There's also a reduction of thyroid peroxidase antibodies, which is the antibodies indicating autoimmune response, indicating a decrease in the autoimmune response against the thyroid. The antibody levels in group 1 were significantly lower than group 2, which is attributed to the anti-inflammatory effects of laser. Check this out. Laser inhibits production of pro-inflammatory cytokines such as tumor necrosis factor alpha, interleukin-1 beta, and IL-6 by inhibiting gene expression. Boom. For those of you who have been on the calls the last 2 weeks, where have we heard this before? TNF-alpha, interleukin-6. TNF-alpha, interleukin-6, right? 2 weeks ago, the purpose of the video was to cover the possibility that your chronic inflammation that isn't responding to anti-inflammatory drugs or natural means may be due to you having genetic mutations in the genes that code for TNF-alpha and interleukin-6, making you produce more than is normal. So you're more inflamed than the baseline person. Well, this is saying the laser inhibits TNF-alpha production and IL-6 production by inhibiting genetic expression, right? And in those videos, we talk about you might have the gene variant, but it doesn't necessarily have to be turned on, right? It might never be turned on. When it is turned on, though, because of lifestyle, environment choices, now that gene mutation has its impact. So now you're producing too much inflammation. Well, the laser shut it off by inhibiting the gene expression. So this study suggests that laser is one way to turn off the genes that are driving TNF-alpha and IL-6. And reducing those levels reduces the inflammation that drives damage in autoimmunity. So that is big time, and that's a huge tie-in back to our video 2 weeks ago, and then last week when we were talking about how that inflammation affects TSH levels and brain control of thyroid and vagus nerve function. So in conclusion, our results are encouraging, and laser seems to be very effective in increasing T3 to T4 ratio, decreasing thyroid autoimmune antibody levels, and decreasing thyroid hormone replacement levels. Boom, laser for thyroid. We can look at vitamin D for Hashimoto's disease, and we'll look at these two studies as well. So can supplementation with vitamin D modify thyroid antibodies? That's what they wanted to find out in this study. And so what they did was they looked at vitamin D deficiency has been repeatedly demonstrated in Hashimoto's patients. So Hashimoto's disease is associated with low vitamin D levels. So what they did is they gave Hashimoto's patients 50,000 IU of vitamin D per week for 3 months. And then they observed for a reduction in antibody levels and TSH levels and that sort of thing. So this study found that there was a significant reduction of thyroid antibody, thyroglobulin, and TSH levels in the vitamin D group. So vitamin D helped decrease antibodies and decrease TSH, which suggests better thyroid function with lower TSH suggests better thyroid function because hypothyroidism is seen on labs by lab high TSH. And then if you're lowering the antibody level, again, that's suggesting you're lowering the autoimmune attack. There's a 2020 study looking further at the correlation between Hashimoto's and vitamin D. And so I want to show you this because, the Endocrine Society guidelines for determining what is vitamin D deficiency is as follows. Remember, the normal range, quote unquote, of vitamin D on your LabCorp test, if you look at the normal reference range, it's going to say between 30 and 100 nanograms per milliliter. Okay, that's a huge range. Well, the Endocrine Society says if you have greater than 30, you're sufficient in D. If you're between 20 and 29, which would be lab low on a LabCorp's normal range, that's only insufficiency. It's not until you're less than 20 that you're deficient. Okay, that's what the Endocrine Society's guidelines say, which is ridiculous because the normal vitamin D level is 30 to 100. Anything less than 50 is insufficient. Anything under 30 is lab low, so that would be deficient. Okay, so this study is studying people who are extremely deficient because they're not even calling you deficient unless you're less than 20. So they took over 5,000 people and they were looking at TSH levels and vitamin D and Hashimoto's, the thyroid, etc. So here's what they found. TSH levels in the insufficiency group and the deficiency group were higher than those in the sufficiency group. So people with good vitamin D had better TSH levels, so that makes sense. Free T3 and free T4 levels in the insufficiency and deficiency group were lower than those in the sufficiency group. Again, that makes sense. If vitamin D is correlated with thyroid hormone levels, if you have sufficient vitamin D levels, you're going to have better thyroid hormone levels. So if people had insufficient or deficient D, they had lower thyroid hormone levels. So the conclusion of the study was patients with Hashimoto's present with lower vitamin D levels. TSH is negatively correlated with vitamin D. So if your vitamin D is low, your TSH is correlated to being high. And remember, high TH is an indicator of hypothyroidism, so low functioning thyroid, which is the most common cause of Hashimoto's disease. And then free T3 and free T4 were positively correlated with vitamin D. So if D levels are good, those levels are good. Okay, so again, here's science evidence showing us that vitamin D can have a huge impact on your thyroid function before you have Hashimoto's and then when you have Hashimoto's. So those are 2 studies on D for Hashimoto's. Again, I said earlier, my book, chapter 7, I talk about thyroid autoimmunity, and in there, I talk about nutrition for Hashimoto's, both what to eat and take and what to not eat and not take or avoid in order for best outcomes for Hashimoto's. So how is your Hashimoto's being addressed? If you're out there and you're getting typical conventional medicine care, you've been told you have Hashimoto's disease, you've been given Synthroid or levothyroxine, which is the generic form, and sent on your way. You probably weren't tested for your vitamin D levels or asked about it. You probably weren't asked about your nutrition or your stress levels or your sleep or your physical activity. You sure as heck weren't offered laser therapy. They probably didn't look at your iron levels and selenium levels either, or vitamin A or glutathione or other things I talk about in my book. So if you're out there with Hashimoto's and you are living a less than optimal life, then teaming up with a functional medicine practitioner could be key for you. Teaming up with an office that can provide laser therapy could be key for you in helping you maximize function of your thyroid and minimize the dose of thyroid hormone that you have to take each day.